Salicylic acid is a close relative of today's aspirin, which is chemically acetylsalicylic acid. Salicylic acid occurs naturally in the bark of the white willow tree. Its use dates back to the godfather of modern medicine, Hippocrates, who documented its use in combating pains, aches, and fever. In recent years, experts were led to believe that cancer patients were suffering from a salicylate deficiency. Aspirin's anti-cancer power stems in part from its capacity to inhibit cyclooxygenase 2, better known as COX-2. COX-2 is an enzyme discovered in 1991 that has been shown to be key in the onset of most cancers. COX-2 is released in response to infections, cellular stress, and other pathological states. COX-2 and its enzymatic byproducts accelerate cancer development via 5 pathways. They trigger the formation of new blood vessels that tumors need to nourish themselves and grow. They halt apoptosis, which is the normal process of programmed cell death that keeps malignancies from growing. They inflict DNA damage, which increase the risk of cell mutation. They stimulate cancer cell proliferation, metastasis, and they suppress the immune system, which would otherwise destroy cancer cells before they take hold and multiply. Aspirin is a powerful suppressor of these carcinogenic processes. Nuclear factor kappa B is the master switch that stimulates pro-inflammatory cytokines. Very simply, aspirin suppresses nuclear factor kappa B activity, effectively stopping cancer cell function. Now, these are the good effects of aspirin. On the other side, aspirin can put holes in your stomach and esophagus if used long term. So the drug companies, rather than use something as cheap as aspirin, have developed similar products, COX-2 inhibitors, that demonstrate anti-cancer effects almost identical to aspirin. The problem is that these compounds are much more expensive than aspirin and are much more dangerous. The new compounds are linked to a various amount of cardiovascular disease states, some of which would cause death. So here we are with our XanGo juice, a safe alternative to both aspirin and the drug company's compounds. XanGo juice is documented to be COX-2 selective, which means it doesn't affect COX-1, the enzyme which is beneficial. Of course, the most important issue is that XanGo juice is safe. To date, no one has died from drinking our juice. The choice is yours. Take aspirin and have severe digestive problems, or take the drug company's compounds and die of a heart attack, or drink safe XanGo juice every day, 3 times a day.